Hello, everyone, and welcome to our 24th hour of the 24 hours of rare portion of the event. It's so good to have you joining us. With us now are three great individuals from three different countries that are going to be represented. Dr. Daniel Sherman is in Paris, France. Simona is in Rome, Italy, and Daniel is in Spain. And so with that, I'm going to turn the floor over to Dr. Sherman for his presentation. Dr. Sherman, floor is yours.
Thank you. So I'm going to make no more than a 15 minutes presentation. First of all, I want to thank 24 Hours of Rare for giving us the opportunity to present what we are doing for the rare disease field. So we are the Foundation for Rare Disease, and here are our coordinates where you can identify and find us and write to us. But first, I will present the global landscape of research in the field of rare disease. So this is at the international level, the general organization of stakeholder is HoR, which is the International Research Consortium for Rare Disease. It has several goals, and it's sort of guide for all the rare disease associations which are adherent, and mainly a lot about research and how to accelerate new therapies for rare disease. So they are setting up the goals and the rules, and they are trying to answer questions like access for medical treatment, which can be very expensive to rare disease, repositioning. If you want to know about their activity, you can just go on their site by Googling on HoR. When you get down to the organization of research and patient organization at the European level, you can disseminate three organizations. You have the European Reference Network, the ERN, which bring highly specialized professionals from different EU member states, and they coordinate themselves to progress for their medical practice. So it's European because you have little patients, so you have maybe the expertise can be scarce and in many different countries, and this ERN have been proved quite useful for the organization and cooperation in the field of the medical service in terms of making a network between the reference center throughout all Europe. And the European Union is actually funding an 80 million euro joint program for rare disease and aiming at pushing collaboration at the European level between research teams involved in rare disease, and we are part of EGP. For instance, our foundation is responsible for an e-learning that will be made available to everybody on different aspects of rare disease, clinical, human genetics, clinical development, translational research, and so on. And we are also heading a joint translational call, which is in this year dedicated to social and human sciences. And we try to gather association, clinical expertise, and social or psychological human sciences specialists in order to work on how to improve the day-to-day life of patients and families and their integration in a normal life. And you have HoRDIS that you may know, which is a non-governmental alliance of patient organizations, which represents about 800 different patient associations throughout Europe, and which is actually lobbying to improve the status of rare disease throughout Europe and even at the United Nations organization level. Now I will shift gears to the rare disease stakeholder organization in France. In France, we are really aware of the rare disease cause, and since 2005, it's a public health issue with 3 consecutive rare disease national action plans and collaborative work between actors of research, care, and patient association. And we have created in France about 2,000 competence centers for very specific rare disease, which are gathered in about 400 reference centers. And these are coordinated in what we call filières, which gather a reference center in disease which have the same, belonging to the same family. So I will not go into the detail, but you see, for instance, the brain team filière is concentrating and gathering all the reference center on rare disease from the central nervous system. This is Cardiogen for cardiac rare disease and so on. And so you see that we have field-wise for liver rare disease, about 80 rare disease on the liver, which concerns 10,000 patients. So you see, this is a way for patients and families to get access to quite expertise, and from this filière, they can be directed to the best, to the optimal reference and conference and reference center for their particular disease, because as you know, 6,000 rare disease, you need this kind of classification. So now I will shift gear to our foundation for Rare Disease, FFRD. We are a foundation for scientific cooperation. We are created 8 years ago by the Ministry of Higher Education and Research. And we have 5 members, funding members. They are funding, but they are not founding. Only AFM Téléthon is founding us. The other one were funding us, but they don't give us money anymore. But AFM Téléthon is supporting us. INSER means National Research Institute of Health. We have the conference of the president of university, and we have the conference of the hospitals, French hospitals. So we have the care, people involved in care, we have people involved in research, and we have the organization involved in patient, which is AFM Téléthon for neuromuscular disease, and Alliance Maladies Rares, which gathered about 300 patient associations in France. So what do? We are supporting and financing research through 5 calls for project per year. We have a scientific committee, and the scientific committee is in charge of classification for the project to determine which one we are going to support. We have more than 700 experts. We have a staff which is in all French region, which advise and accompany scientists, doctors, patient associations in order to develop their own scientific panel if they want. We help patient associations for their day-to-day research, and we have also some work with pharma and biotech in order to, I will come later, to fuel pharma and biotech by proof of concept that we mine in the community, in the scientific community. And we are animating and federating the rare disease community. For instance, we organize the RARE meeting in France. We organize a yearly scientific meeting on rare disease. We organize scientific symposium on a regular basis at the national and regional level. And we also give lessons on what is research for rare disease, lectures for Alliance and other stakeholders. Our objective is how to help understanding rare disease. So we finance projects in the field of diagnostics, and as this call is called genomics because it's a human genetic call. We finance research for new treatment, disease mechanisms, therapeutic approaches, preclinical development, and we have calls for financing models for rare disease. You know, it's very important in order to find a solution before going to human. Translational call in large animal study and high throughput screening And we have what we call human sciences, social and human sciences call, in order to improve day-to-day life and to study how to improve social and professional isolation of the patient and their family. And this is original because for every project that we support, we need a consortium of 3 partners. One SHS team, psychological or ethics or sociology, one clinical team, and one patient association. If we don't have these 3 partners, we don't support the project. So since our creation, we have received more than 1,000 submitted projects. We have granted about 400, which is about 35–36% success. We don't want people to lose their time writing grants that are not going to be supported. So we want a high rate of granted. We have spent more than 12 million funds, and we are working with a specific platform in order, for instance, to build up the models of rare disease. So 30% success rate, and we have been able to finance some human genetic studies that have identified more than 90 genes which are causative of rare disease, because 90% of rare disease are genetic disease. We accompany the proof of concept from academic teams, and we scout them and we present this proof of concept to big pharma and biotech. We don't take any compensation from the teams, from the academic team. We don't take any intellectual protection. We are here to help and to serve, so we have no conflict of interest. We just have a role of putting in contact the academic teams with potential big pharma and biotech that will develop their proof of concept toward a drug. And we accompany, help patient association. We have different way of helping them: information and scientific research, strategic and organizational advice, linking with researcher, expert identification, editing calls for project, fund management, assistance with contracting, and we can manage their scientific project if we make a contract with them. And all this is at no cost, which means if an association wants to finance a project and they have gathered 20,000 euros to finance a scientific project, we find the laboratory and we make the convention with the association. They give us the 22,000 euros, and then we make a scientific agreement with the lab, and we monitor the project. We ask for regular report, and we deliver. We give the 100% of the money that we receive from the association. If we receive 20,000 euros, we will dedicate 20,000 euros to the academic team to do the project. We don't keep anything. We think that all the money from the association has to go to the science that is going to use it to find eventually a cure. So we have some partnership, like for instance, we have some partnership with some GIRC means group, regional groups for clinical investigation, hospitals. We made some common call for project with them, and we made them accept that they could finance by their own funding 450,000 euros. It was not our money. They invested in rare disease because we convinced them of the utility of investing in rare disease. We are working, for instance, with the Hospital University network on a cure of overgrowth syndrome with Professor Guillaume Piano, which obtained incredible result to cure some overgrowth syndrome by repositioning of drugs. We have a regular, as I mentioned, a scientific event. We try to promote e-health project by organizing the workshops and trying to find the funding, to find working people that are going to help to pay for this project. Like we try to interest companies, and we try to interest insurance company to finance this project. And we are partner of the European Rare Disease Consortium. And with this, I would like to thank you for giving me the opportunity to present the work of our foundation. So if you want to find us, we have an internet site in English and in French, Fondation Maladies Rares, or Foundation for Rare Disease. You will find us on our internet site, and I would be welcome to answer I would be happy to answer your question. Thank you.
Thank you, Dr. Sherman. Next up, we have Simona, who is based out of Italy, and she's going to be talking about the rare disease efforts that are taking place there. So, Simona, I'll turn the floor over to you.
Thank you, Jeff, and thank you from my side to having me today here with you to celebrate Rare Disease Day within this fantastic rare disease marathon. And it's a huge event. I'm very happy. So I want to start in wishing you, even though it has already passed, a good Rare Disease Day celebration. And I hope you had the opportunity to read about the Pope's message to all the rare disease community worldwide. And it was an impressive message of solidarity with us, and obviously being in Rome, because as Jeff said, Uniamo, which is the National Alliance for the Italian rare disease community, we were able, as every year, to submit a request to Pope Secretary, and we had this important message that really reached all families across the world. At the same time, I hope you had the opportunity to see all the monuments light up for this celebration, which is very important. Even more this year, where due to the pandemic that affected us even more, because we are a vulnerable community, we were able to create a chain of lights across the world. And initially, we had over 200 monuments and buildings light up for us. And this is very important. Obviously, this was organized, or the idea started from HoR that Daniel just mentioned. And then at national level, we had the commitment of patient organizations and national alliances to light up monuments. And indeed, we succeeded. So this is the first message I want to send to all of you. So as Jeff said, I'm Simona. I'm the aunt of Alicia, a 23 years old now young lady, and my commitment started with her birth because I wanted to help Alicia and my sister to find information, and which at that time were really scarce. And this is why I started with the specific disease patient organization. But very, very soon I understood how networking is the key word in rare diseases. So I joined Uniamo, the National Alliance, and then HoR, and that I serve as member of the board of directors. This is just to illustrate, to understand how, from a personal experience, then in the rare diseases, you really need to come together, because we need to be trained. We need to understand how we can work together. And this is the most important message, because I think that rare diseases can feel everyone very isolated. But you have to understand, we all have to understand that we are a great community, and we have fantastic organizations that are really supporting us as a community. So it has started as a personal experience, a personal commitment, but now today I'm here to talk about the Italian situation and the Italian Alliance. And so I can say that since 2001, initially we had a law setting up the National Network of Rare Disease Center of Experience and the National Registry. We know how registry is important to gather data and to have an idea of the number of people affected by a rare disease to then take action. And in this scenario, in 1999, Uniamo, the Italian alliance, was set up by a small group of patient organizations, but now is gathering over 100 patient organizations. The mission of Uniamo is to improve the quality of life of people affected by rare diseases and their families through the implementation, the promotion, and the protection of the vital rights of patients, of people living with a rare disease, in research, in bioethics, in health, and in social health policies. And this is important because we know that we need an holistic approach, because research is of the utmost importance, but it is also the daily life of the families and people with a rare disease. So what Uniamo does, and to be the voice of the Italian community and their advocates, Uniamo works in collaboration with its patients, with member patient organization on the continuous collection of requests and needs of the rare disease community, also through the development of targeted projects that include the social aspects of the daily life, with a special focus on school and work inclusion. We also work with teachers. We train them. So we organize projects on training and explaining and raising awareness among the teachers and the schools community about rare diseases. And obviously we are the coordinator of the Rare Disease Day events to raise awareness among policymakers and general public. We have a focus on access to treatment as well, because even though we have a national law, Italy has a very decentralized health regional system. So it is important for us, and for Uniamo, this is the main focus, to reach equity in terms of access to treatment, access to the benefits that we have initially and to which people living with the rare disease are entitled to. And the activity of Uniamo is articulated between projects, as I said, and action. And the projects are both funded by public calls, mainly by the Ministry of Labor and Social Policies, and private funding, mainly from pharma. And Uniamo is the National Alliance of HoR. That means that we were able to organize and implement European action or European projects at national level. And this were very important because for the Europlan project, that was a project aiming to the development of national plan for rare diseases, we were able to contribute to the establishment of the first national plan for rare disease in Italy in 2013. Then the national plan expired 3 years later, and only recently a committee was organized for the update of this national plan, and Uniamo sits in this committee. And the Uniamo office is not so big as we heard from our friend Daniel in France. So it's just composed by a secretary and obviously a volunteer and administrative staff. That means that we rely very much on the volunteers. I'm one of the volunteers. I'm the representative for the activity at European level, but each member of the board of directors is in charge of one specific activity. So going back to the national scenario, we have to say that we are very proud that Italy is the European country with the highest number of rare diseases, mainly metabolic, included in the mandatory public newborn screening program. That means they are for free and they are mandatory in every single region. And Uniamo sits in the committee in this national coordination group for newborn screening to ensure the uniformity. Again, this is what I was mentioning before, the uniformity at regional level and the quality of the test throughout the national territory. And now for the inclusion of new diseases in the panel of the screened disease. Uniamo also worked with its member patient organization on a position paper to cover all the aspects of the extended newborn screening system. Another important action or project started in 2014 when Uniamo started collecting from all relevant national key stakeholders data and figures of the actions envisaged by the national plan, and every year in July Uniamo presents the monitorare. So it comes from monitoring, rare, monitorare, this monitorare report, which is the unique example in Europe of a report on the condition of people living with a rare disease made by a patient organization. This report is a public analysis and comparative evaluation of the national system and the different regional systems in the care of people living with a rare disease. And it has proved as a reliable work, also essential in promoting the debate among institution and patient organization and the involvement of patient representatives in several national, regional committee or board on rare diseases. And that's to assure the engagement of patient representatives in all the processes that regards our lives. So we are very happy. We could do more, and we are doing more, and we just set up an agreement with the National Center on Rare Diseases for a newsletter which appears on the website of the Health Ministry. So that was a great recognition of the activity that Uniamo is carrying out. And we are moving forward, so the update of the national plan, but also a national law on rare diseases. And Uniamo is involved in this after a sort of debate with patient organizations, because our voice has to be heard, and Uniamo is aiming to this and to have our needs and rights recognized and addressed in all the laws and actions that we are trying to achieve. So I hope this is a message of obviously commitment, but also hope, because if I remember how the situation was 23 years ago when I started, and I mentioned earlier the scarce information. But now, thanks to ERNs, just mentioned by Daniel, so the European Reference Network, the involvement of patients that now is required by courts and by the European Commission. National alliances, so Uniamo in Italy, is involved in all the activity, and it is considered a reliable partner. So we are moving forward, and I'm sure we will achieve great goals in order to improve the quality of life of every person affected by rare disease and the family. With this, I've finished, and I thank you very much, Jeff.
And thank you, Simona, for that presentation and talking to us about what's going on in Italy. It was fantastic. So next up we have Daniel Gallego. And Daniel, I will share the screen and in just a second and let you have the floor.
Oh, great. Okay. Thank you very much for the invitation. My pleasure and honor to be involved in the Rare Disease Day. I'm Daniel Gallego from Spain. I'm a kidney patient, and nowadays I'm the president of HoR, the Spanish Kidney Patients Federation, and also the president of the EKPF, the European Kidney Patients Federation. As Simona and Daniel has highlighted, we have an unmet needs and challenges around rare kidney disease, and we have an opportunities for action, and this is the main point where we are here celebrating the Rare Disease Day, and I support, of course, we support all the actions, all the activities. Thanks, Jeff, thank Eden for the invitation. Next slide, please. I'm going to share with you the overall vision about the kidney disease burden worldwide, because close to 760 million citizens suffer from kidney health conditions. So this is one in 10 people, and nobody realized about that. And specifically in kidney disease, we have a rare kidney disease among the disease conditions. So it is truly important that everybody knows about the rare kidney disease around the world. Next slide, please. Chronic kidney disease are now in the top 10 of cause of death around the world, and the main concern of us is that in the 2040 will be on the 5th cause of death. We are running to the top during the years, and it is the most neglected disease because it's not in the priorities of the European Union or worldwide for in the agenda of the policy makers. And we are really truly concerned about the kidney disease for the incoming years. Next. The yearly cause of chronic kidney disease nowadays exceeds those that cancer and diabetes. You can see on the right side that the early chronic disease and late chronic disease and transplant and dialysis, all the causes together is the amount is cost average 140 billion annually. So it's more than cancer and diabetes. So you can imagine how the healthcare system is stressed and is concerned about that. Next, please. So the main challenges of the kidney disease, especially in the rare kidney disease, is the lack of awareness, the lack of funding, the lower life expectancy, and the lack of innovation. No, currently CKD is not listed among the research priorities, And chronic kidney disease treatment costs society at least as much as treating cancer, but investment to develop innovative kidney replacement therapies are much lower from cancer. And the current treatment is not life-changing, and has not been any breakthrough innovation in the last 60 years. The kidney rare disease, we don't have an update and advance during the last year, and it's a real problem. And chronic kidney disease patients with an advanced stage of the kidney disease only have 5-year life expectancy, and the mortality rates are worryingly rising. So the next. Regarding kidney disease and the COVID-19 outbreak and the pandemic, you can see on the left the high mortality of the chronic kidney disease. This is the first factor for COVID-19 mortality. 21% of the dialysis patients dies of COVID-19. Even the transplant patients die, and then 20%. So 1 of the 5 patients who has suffered from COVID-19 has died. And until 30% of people hospitalized for COVID-19 die of acute kidney injury. So we have seen the healthcare disruption and the postponement and the continuity to care and the prevention and the trouble diagnosis and the treatments. So essential surgery has postponed. Of course, the research, all the things has been postponed, and the dialysis center became a source of infections. So the activity of organ donation and transplantation has decreased until 80%. So this is because we are claiming that the chronic kidney disease patients should be among of the priority groups for COVID-19 vaccination. And related with all of that, we have the mental health disorders in the kidney disease, because COVID-19 increased CKD patient stress and discomfort because the fear of catching COVID-19 and unclear public health guidance, and the fear of going to the hospital to undergo dialysis 3 times per week. And we have poor access to the health professionals. Next, please. So we are we have a call to action to reduce the chronic disease burden, augmenting the efforts on prevention, because all the politicals will be to the prevention and early detection. So establish an EU framework for the prevention and make research in the kidney replacement therapies in EU a priority. This is because we are struggling to reduce the CKD burden, encourage the research projects on the links between cancer and kidney disease, because it is establishing this funding mechanism that will allow the spur innovation in kidney replacement therapies. And the next, please. This call to action tries to collect and share all the data registry, because we need a real picture of what is going on in the kidney disease, and specifically in rare kidney disease, to creating an institution, the system to collect and compare all CKD data through the European Center for Disease of Prevention. And we are promoting the home therapies, because chronicity to be managed at home whenever is possible, and to take the digital tools. Yes, we are promoting home therapies and initiate the second EU action plan for organ donation and transplantation. But we would like to encourage initiatives through EU for Health that support updating digital tools and digital health literacy programs to try to tackle all the problems at home whenever it's possible. And then next, please. The European Kidney Patient Federation represents over 75 million people with kidney health conditions in Europe, and we have 27 national kidney patients federation from 26 different countries. And our mission, of course, is to improve the patient voice, the patient engagement, the patient safety, and always the dignity with the patient autonomy and independence. The next, please. We have heard about, please, all the next, because I have several here. Yeah, the patient mantras we have heard always is the empowerment of the patient-centered care. And next, we have heard always from the healthcare professional that the patients as drivers of innovation. And next, the humanization of healthcare. And next, we have heard the patient in the DNA day end of the clinical trials or shared decision making. And finally, next, the patients at the heart of the healthcare system. But I think it's not true today. So we are struggling that to become at the center of the healthcare system and try to be involved from the beginning of the design of the clinical trials, the beginning of the design of all the strategies, all the programs, all the initiatives that try to improve our lives, our treatments. And next, please. So what we see of a rare disease, of a rare kidney disease, is only the peak of the iceberg, because we are trying to do a fulfilling life with the disease. The next. So below the peak of the disease is the daily life activities, the daily activities at home, the ability to work, ability to travel. The human impact of the rare disease is what really matters to the patient, and we are focused on that, to try to incorporate the perception of life, the perception of the reality is what really matters to the patient, not only survival, not only the kidney function, or not only the clinical aspects, but also the economical and social and human impact. And next, please. So this is below the peak of the iceberg that everybody sees at the healthcare systems, and we would like to bring out and to all that unmet needs, all the methods to the patient. Next, please. Here you can see the rare kidney diseases list. We have a lot of kidney rare diseases that we don't have cure, of course. We don't have treatment specific for all these diseases. By the way, I've been diagnosed with focal segmentary glomerulosclerosis 25 years ago, and we don't have seen any update or any treatment for that. We are still waiting that we can now have more knowledge and more research about that, and genetics, renal diseases like ADPKD, the autosomal dominant polycystic kidney disease, for example. And you will see we have created an alliance for ADPKD to try to increase awareness and increase the knowledge about these kidney rare diseases. Next, please. And what is the meaning of kidney rare disease for people? Of course, you have an identity crisis, and you have a rejection of appearance because you have an aversion to the treatment and the medications, and they are limiting your lifestyle. Everybody knows how is the suffering about people with the fear and uncertainty, because we don't have any specific treatment and to improve or to cure your illness. So you don't know really what it means to be normal. And many patients that are diagnosed with kidney rare diseases, they believe they are going to die because they don't have any treatment or any specific drug that could improve and could be the solution for them. The next, please. So this fear and uncertainty, it turns that this is an old path that we are on the road. Of course, everybody knows that the rare disease have guilty feelings. You don't know why you have this disease, and it becomes sometimes an obsession. and you have these feelings of powerlessness. And of course, we need the programs of need an accompaniment and ongoing assistance for this fear and uncertainty because you are lost or confused or disoriented about that the medicine is unable to give you the solution. The next, please. So the key, the key of empower of people is education. It's not only information. So this is because we are doing a peer-to-peer programs or promoting the self-caring with educational programs and motivational interviews to try to give them the reliable sources on the internet, because you know the Dr. Google, everybody is searching on the internet about the disease. So we are trying to support with educational programs. The next, please. Yeah, next one. Yeah, this is more or less what we are trying to do, to empower people to face and to deal the rare diseases. And of course, this program is the main goal is that at the end they don't need us at all as patient organization or as a healthcare professionals. Our successful is that the patients don't need us at all. Next, please. And we have several unmet needs associated to the kidney rare diseases, because from the clinical perspective, it's truly important, of course, the survival and all the analysis. But for the patients, we have next, please. You can pass everyone now, because we don't have until now a solution for the pruritus or for the sleeplessness during our journey. And the next one, we feel fatigue and we are not able to do the daily activities live. Next, please. And we suffering from the chronic pain, and of course we are struggling with emotional disorders like stress, anxiety, depression, and the mental health is truly important for us. And one thing that we usually forget about the professionals is the sexuality. Next one. The next. And the sexuality, of course, it really matches to everybody, and the sexuality is present on the lifelong, is present on the whole of your life. So I think it is truly important. Next one, to tackle and to address all the unmet needs that to associate to the kidney rare diseases. Next one. And of course, the mental health must be addressed in rare diseases, because everybody is suffering the anxiety and depression, and we need practical tools, and we need an ongoing assessment to try to help everybody to face in the different stages of negation or anger or depression, or until the acceptance that you have a rare disease that don't have cure or treatment until today. So any information or results can help anyone. Everybody is unique, and rare diseases are unique. So you need a specific tackle to a specific approach to your rare disease. And I think that the mental health is always forgotten by the authorities. The next one. So what could be the expectations of a rare kidney disease patients or rare diseases in general? I think the first one is being out of the hospital, not to have the treatment at home, because home and family is a therapeutic element itself. And I think one of our expectations could be being out of the healthcare system, because we spend a lot of time there. Next one. And of course, one expectation is to don't feel any pain because the disease, because sometimes it's related with a lot of rare diseases is related with pain. The next one. Another expectation, of course, is to have an independence and to have autonomy and to have the ability to travel, ability to work, and an ability to do whatever you need or whatever you like as the rest of the people, even despite your health. And next one. And of course, a rare disease is would like to be treated as normal. Is normal. I don't know exactly what means normal, but you know what I mean. Treated by normal is like the rest of the people, because as you are suffering a rare disease, but you are a person with hobbies, with dreams, with so you are trying to do your best, and you are trying to have a normal life. The next one. So maybe next one, the medicine, we are expecting that the medicine could perform more than your expectation. No, expectations is always right through the one point to another point, and the reality goes more go to the right or go to the left, but not always straightforward to the point. So this is what we like, that the medicine could perform, next one, beyond our expectations, and could give us a real solutions, a real treatment for our rare diseases. The next one. So, and related with hopes, we would like to have to live a fulfilling life and to be healthy despite your rare disease. This is our hope as patients. And next one. Always being positive. I think the attitude is the most important thing, even in the rare diseases. Always keeping your hopes high. And next one. Of course, to be loved with a human caring and a human touch, I think is truly important in the rare diseases, especially for us, for the kidney patients. Don't have a waiting list. If you need an organ or if you need a kidney, to have to be ready the day after, and not to are waiting for years for a kidney replacement therapy. The next one. And next one. And of course, to have the cure for our diseases, even if it's rare diseases, and with kidney regeneration organs, or a solution that real portable machines or tiny machines that could do the kidney function 24 hours per day, every day. Next one. And of course, always with, we are in the same team, healthcare professionals and patients. I think we are fighting against rare diseases on the right side. So we are facing the disease, and I think the health and hope is always together, fighting with it for the same reason. Next one. And you can see our claims, as patients. Next is to have voice, because we would like to be heard in all the institutions or in all the healthcare systems, to have a real voice and to be heard as an equal. Next one. Next. And of course, one of our claims is to have choice that enables shared decision making, to have options, and to know all the updates, all the advances, all the treatments available for the rare diseases in one time. And next one. And one of our claims is to have a co-production. We would like to co-produce all the guidelines, even its clinical guidelines, all the clinical trials, and all the materials, all the approaches that we could co-produce with the healthcare professionals and all the stakeholders, with the industry, and the patient organization must co-produce these materials, because it's what really matters to us. And finally, next one. This is an alliance of all the stakeholders. I think we could achieve it. Next one. And I think the term of the concept is the co-responsibility. So we need to be involved and to tackle the responsibility with the healthcare professionals together, and to make efforts to be better and to be involved as an equal. Yeah. And next one. And the patient engagement in rare diseases, of course, is to be involved in the clinical research ethics committee. As you know, a patient representative could be in the ethics committee. So we are in, and we would like to share with the clinical research the expertise and the experience, and of course, you know very well the UPATI, the Academic Information for Patients, and we are involved in next one as volunteers. So maybe we could be compensated for our time, our expertise, and our experience. And I think the patient report outcomes measures and the patient report experience measures is crucial to be incorporated to the clinical research and the clinical trials. Next one. And you can see here how the patients could be in the clinical trials for the design in the earlier stages of the clinical research to improve the final outcomes. Next one. And because we would like to have a one step beyond and sit at the table with all the stakeholders and our opinion to be heard, to design all the health policies process and the health strategy committees in development this clinical guideline and the care process, they design evaluation of the results. This is the one step beyond. We are asking for the policymakers and the research institutions to be involved like one. Okay, next one. And this is an example of an alliance we have created in Spain in 2015. 7 organizations, including patient organizations, medical societies of nephrology, nurses, and of course the research institutions. We are trying to create this alliance to improve this rare kidney disease, what is ADPKD, the autosomic dominant polycystic kidney disease. And this is, I think, a good example of alliance to improve the knowledge and to improve the outcomes. Next one. This alliance of ADPKD is a multidisciplinary team made up for patient and healthcare professionals involved in the fight against ADPKD. The alliance works in collaborative and dialogue environment to develop recommendations and guidelines which to improve the healthcare received by patients with the disease in Spain. Next one. And we have published a white book, and I think we need more white books in rare diseases to increase the knowledge, to improve the outcomes, and to tackle the disease with the one only perspective for all the stakeholders involved. Next one. And last but not least is to take rare HoR messages. I think for us, for the kidney rare diseases and rare diseases in general, the crucial and the real important is the human and caring touch. And to have this slogan, or it's no decision about me without me. This is because we would like to be involved, and we are always promoting the self-caring and empowerment of people with education. So please ask us for strategies and programs in rare diseases. We are more than patients; we are truth seekers. So we are always seeking the truth in our disease. So please include the report experience as crucial, and ask us to be involved in the research and the clinical trials from the early stages, not only the stage 3 and the stage 1 to design of the clinical trials. And I think we should work in the acceptance of the rare disease of the patients, because on the acceptance of the you have a lifelong disease is truly important, that to manage everything. And my final message is rare disease is like a ride on a bicycle. To keep your balance, you must keep moving. We must keep moving in the updates, in the advances, in the research, and we must push the community. We must push the institution, the policymakers to keep our balance and to give us the solution, the final solution for the rare diseases. And the next one. And thank you very much for your attention. My pleasure, and of course I'm available next one in my email, or if you like to discuss more about the AKPF or AKPF rare diseases, kidney diseases, and more than happy then to be here today. Thank you very much.
Thank all of you very, very much for your time today. This has been just amazing. Do have a couple, just real brief, 2 quick questions to ask to see what everybody's feedback is. Is that Europe seems to be united and collaborating well across these country borders. Do you all feel that, or do you feel that? I mean, obviously, there's probably always wanting more collaboration, but how do you see that? Do you think that there is good collaboration there?
Well, I think Daniel and Simona have an alliance that they could answer, but of course, from my perspective, we have a lot of work to do, because we are incorporating to the committees, to the roundtables, to the trials, but yeah, everything is still to be done, and I think it's the beginning, and at least they are calling us, and they are trying to involve us as a patients, but yeah, we are in the beginning of the road.
In research is going well. I mean, the coordination at the research and clinical level in Europe is really a success. It has to be improved and enlarged, but we are on a good track.
Indeed, if I may add just a few words, I fully agree with Daniel, both of them. And Daniel mentioned IRDIC, which is a worldwide consortium, but also ERNs, the European Reference Networks. I think this is the right direction. So as I said previously, networking, gathering expertise, and the engagement of patients, as Daniel just said, at the early stage. So setting up an early dialogue with all key stakeholders involved is of the utmost importance and is essential for the future achievement. We only can achieve our goals in research, in all the other areas, if we are working together. So the collaboration is moving forward. Patients are increasingly recognized even though I fully agree with Daniel, it's not enough, not every time, not always, but we reach a sort of recognition. It is true that that's my personal perspective, not only personal, I suppose. We should, if we are required to be so engaged, patient engagement should be funded and recognized more, because most of them, we are volunteers, we are experts by the daily life experience, but we are trained. U-Party was mentioned, URORDIS has an open academy with the regulatory aspect of the research, on the laboratories, activities. So we are trained and more trained to be really part and contributors of the achievement of the development of research. So that's the way, and we are advocating for this. Did we answer to your question, Jeff? We lost you.
Yep, I think we lost Jeff.
Okay.
Okay. Well, while we are waiting, yes. Yes.
Sorry that I had a little technical difficulty there. Can everyone hear me now?
Yes, we can.
All right. So yeah, that does answer my question, Simona. The last question I have is that, so outside of that European group there and your things with it, like even with like here in the U.S., how do you see collaboration? Does it work well coming across the pond, so to speak, with this? And what can we do to make that even a little bit more seamless?
Yeah, but it does, as Daniel, the French Daniel mentioned, IRDIRC, it's the both sides of the oceans consortium. So we are working together on the both sides, and I'm sorry. And it is true that we have to go cross borders. Research has no borders, it shouldn't have any borders, because we can only achieve our goal, and we can meet our needs if we collaborate. So no silos anymore. And I think the vaccine for the COVID pandemic has been proved as the right way, and at least more or less, but how we can improve and accelerate research if all we work together. So no more silos, no differentiation between farmers or patients, organization or academics. But if all experience is put together, that's the only way to move forward. Both sides of the oceans, obviously.
Yeah, I think, you know, we in the field of rare disease, the emerging biotherapy, gene therapy, cell therapy, genetic pharmacology, interfering siRNA. I mean, the American USA are so fast and so strong. We have to work with on both sides, because it will benefit the patient. They have the infrastructure to go fast, and I mean, if we combine science and the power on both sides, it is the only way, because these are rare disease, small number of patients, scarce resources, and actually more resources in USA than in Europe. So we have to work with USA, and we have to. I am in the case now of practical case. I was speaking this morning with a family, and we might finance an animal model for a specific rare disease, but they are working with an American foundation, and they were asking, are we going to share the models that we are going to make in Europe? And I said, yes, of course. I mean, if we build a mouse model, it has to be able to go to any teams that would be able to work on it to improve and to go faster on therapies. So of course, we are going to send the transgenic mouse to the American labs at MIT because we would be happy if they can progress and using this model for the sake of getting a therapy. So we are really welcome and open to any kind of collaboration with any kind of American institution.
Yeah, I think my opinion is the concept is to build broad bridges and no breakers, no, and the bridges, of course, is to collaborate. I think the approach should be in the multidisciplinary and interdisciplinary teams, including patients, of course. And I think this is in the incoming years what is going to be, because everything is related. All the diseases are related. We have a lot of comorbidities, and we have several and elderly people with a lot of rare diseases or with a lot of diseases, and always interconnected. So I think this is the solution for the future to work together. And we are working actually with the AATP, with the American Kidney Patients Association, and building this bridge to trying to learn from each other and try to improve because we are in the same team working and fighting the rare diseases on all together.
Oh, this is awesome. Thank each of you. This has been a great conversation across this across with all of you. So thank you for representing your countries and your diseases and your organizations so well. Thank you for the speakers. Thank you to Travere for putting us in contact with you so that we can make this happen. And you know, we really appreciate what you're doing, and so happy that we could share this with the rest of the world. So with that, we're finally through our 24 hours of rare and finished strong. Thank you all so much for your time. It's been greatly appreciated.
Thank you.
Thank you, Jeff. Thank you.
Thank you very much. Our pleasure. Yeah. Stay safe. Bye.
Thank you, Daniel.
Bye.